Zileuton tablet is used to control and prevent symptoms caused by asthma, such as wheezing and shortness of breath. By controlling these symptoms, it helps you maintain your normal activities and reduces time lost from work or school. It's important to use this medication regularly for it to be effective, as it does not work right away. It should not be used to relieve sudden asthma attacks. If an asthma attack occurs, use your quick relief inhaler as prescribed. It's important to note that this drug is not recommended for use in children younger than 12 years due to the potential risk of liver problems. The dosage and timing of taking this medication will depend on your individual condition, so it's important to follow your doctor's instructions. Before you start taking Zileuton, make sure to read the patient information leaflet from your pharmacist. Take this medication by mouth as directed by your doctor, usually 4 times daily. It's important to use this medication regularly to get the most benefit from it. Try to take it at the same times each day to help you remember. Even if you start feeling better, keep taking this medication and do not change the dosage without consulting your doctor. If your asthma symptoms worsen or you find yourself using your quick relief inhaler more than usual, seek medical help right away. If you experience stomach upset or abdominal pain, it's important to let your doctor know. This medication is prescribed because the benefit to you is greater than the risk of side effects. Most people using this medication do not experience serious side effects. However, it's important to contact your doctor right away if you experience symptoms of liver disease, such as nausea, loss of appetite, or yellowing of the skin. You should also seek medical help if you notice signs of a serious allergic reaction, such as rash, swelling, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of possible side effects, so if you notice any other effects, it's best to contact your doctor. Before taking Zileuton, make sure to talk to your doctor or pharmacist if you are allergic to it or if you have any other allergies. This medication may contain inactive ingredients that can cause allergic reactions or other issues, so it's important to discuss this with your pharmacist. Before using this medication, also inform your doctor or pharmacist about your medical history, especially if you have liver disease or if you use alcohol. If you are planning to have surgery, it's important to let your doctor or dentist know about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. For older women, there may be a greater risk for liver problems while using this medication, so it's important to be aware of this potential concern. If you are pregnant, this medication should only be used when clearly needed. It's important to discuss the risks and benefits with your doctor before taking it. It's also important to note that it is unknown whether this medication passes into breast milk, so consulting with your doctor before breastfeeding is essential. When taking Zileuton tablets, it's important to be aware of potential drug interactions. These interactions can change how other medications work in your body or increase the risk of serious side effects. It's crucial to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without consulting your doctor. Zileuton tablets can slow down the removal of other medications from your body, which may affect how they work. Some examples of drugs that may be affected include fezolinetant and pimozide, among others. It's important to discuss any potential interactions with your healthcare provider to ensure the safe and effective use of this medication. If someone has taken too much Zileuton tablet and is experiencing severe symptoms like losing consciousness or difficulty breathing, it's important to call for emergency help right away. In the U.S., you can reach out to your local poison control center at 1-800-222-1222. In Canada, you can call a provincial poison control center. It's important not to share your Zileuton tablets with anyone else. While taking this medication, you may need to undergo certain lab or medical tests, like liver or lung function tests. Make sure to attend all your medical and lab appointments and consult your doctor for more information. Additionally, try to avoid substances that can worsen breathing problems, such as smoke, pollen, pet dander, dust, and mold. If you forget to take a dose of Zileuton tablet, take it as soon as you remember. If it's almost time for your next dose, then just skip the missed one and take the next dose at your regular time. Don't take double the dose to make up for the missed one. It is important to store Zileuton tablets at room temperature, away from light and moisture. It should not be stored in the bathroom, and it should be kept out of reach of children and pets. When it comes to disposing of Zileuton tablets, do not flush them down the toilet or pour them into a drain unless instructed to do so. It is important to properly discard the product and it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for proper disposal methods. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.